Blood tests alone are an awful way to decide the health of your heart. I've seen it over and over. Your last cholesterol test came back normal, and your doctor told you that your heart is fine. It might surprise you that a normal cholesterol results tells me almost nothing about whether you're heading for a heart attack. And I say that as the cardiologist who orders those tests every single week. So before you file your heart away under sorted, let me show you what blood tests cannot see. Because there is a scan that shows it in about 10 seconds, and most people have never been offered it. I've had this conversation with a lot of relieved people who thought their good bloods were the whole story. So let me walk you through how someone with perfect numbers can still have real disease in their arteries, what actually shows it, and whether you're someone who should go looking. Stay with me for the last part, especially because that's where I will tell you genuinely who needs this and who can relax. Here's the belief I'm up against. My numbers are normal, so my heart is safe, and I understand why it feels solid. You get a letter that cholesterol's in range, the doctor sounds pleased, and you get on with your life, job done. But a blood test is a snapshot of what's flowing through your system on the morning you happen to get stuck. It's useful. It's just not a picture of what's already built up on the walls of your arteries. Those are two very different questions, and people walk out the door thinking one answered the other. So let me show you the gap. When I send people for a scan that looks directly at the arteries around the heart, I find plaque, the fatty buildup that eventually causes a heart attack, in a lot of them, around 6 in 10 men and 4 in 10 women. And here's the bit that gets me. Plenty of those people have lovely bloods, normal cholesterol, normal blood pressure, feeling completely well. No symptoms at all. The buildup is sitting there growing years before it would ever show up in a number on a page. Think of it like a house. You can love how it looks from the street, freshly painted, tidy garden, and still get a survey done before you'd ever buy it, because the survey looks behind the walls. Your bloods are the look from the street. The scan is the survey. So what is this scan? The simplest version is called a coronary calcium score. It's quick, it's low dose, you're in and out. What it does is count the hardened calcified plaque in the arteries of your heart and gives you a number. 0 means the scanner did not find any hardened plaque. A number means there's more of it there. And that number is genuinely useful. A 0 is good, reassuring for most patients, and I love giving it. A high score is the early warning you actually want years before it becomes an emergency, while there is still loads you can do about it. I'll be straight with you because I don't want to oversell it. A calcium score mainly picks up older hardened plaque, so it's not a promise that every artery is perfect. If you've got symptoms or a strong reason to worry, there's a further scan we can talk about. But as a first look at whether trouble is brewing, it's one of the most useful 10 seconds in medicine. If you are under 50, you should have a CT coronary angiogram, which is part of the calcium score, because sometimes the plaque is soft. Should you get one? This is a conversation to have with your own doctor. But let me tell you who I lean towards sending. If you're in your 40s or your 50s, you've never really had your heart looked at, it's worth raising. If heart trouble runs in your family, especially young, it moves right up the list. And if you're one of those fit, busy people who feels grand and assumes that settles it, you might be exactly the person that the scan is built for. Who can relax? If you're young with no family history and no risk factors, you probably don't need to go rushing off for a scan tomorrow. I'm not trying to frighten you or trying to frighten the whole world into a scanner. I'm trying to catch the people who are walking around reassured when they shouldn't quite be. So a quick gut check. Has anyone actually looked at your heart, or have you just been told your bloods are fine? Do you have heart trouble in your family that nobody's ever factored in? Are you over 40 and coasting on the fact that you feel well? If those questions made you a little uncomfortable, that's not a bad thing. That's the nudge to book a proper conversation instead of assuming. Because that's the whole point I opened with. Your good bloods aren't lying to you. They're just answering a smaller question than you think they are. The scan answers the bigger one, and the people it helps most are nearly always the ones who were most sure that they didn't need to have a CT, coronary angiogram. So, if you take one thing from me today, let it be this. Don't let a normal cholesterol result be the end of the conversation about your heart. Ask your doctor whether a calcium CT coronary angiogram or calcium score makes sense for you. And if you're now wondering why your cholesterol numbers matter so much less than you were led to believe, I made a whole video exactly on that. I explain what's really driving heart disease when your cholesterol looks fine. Watch this one next. If this is the kind of thing you want more of, subscribe, and I'll see you there. A clear blood test is a good start. It isn't a clear heart. If you've been coasting on good numbers, go and find out what's actually happening in there while it's still easy to change. Go watch that next video and go and have that conversation.